Hello and a very warm welcome to UMCC Medical Consultants Connectors, your trusted space for clear and caring health information. We are so glad you have joined us today. We believe that knowledge is empowering, and our goal is to make complex medical topics simple and easy to understand for everyone. Your health and well-being are at the heart of everything we do. Before we begin, please consider subscribing to our channel. Your support helps us reach more people. Remember to like this video and share it with anyone who might find it helpful. Your engagement makes a world of difference. Today, we are going to talk about a condition called Down syndrome. You might have heard of it before, but perhaps you have questions. We are here to provide clear and gentle answers. Down syndrome is a condition that a person is born with. It is not an illness or a disease. It is a genetic condition, which means it has to do with a person's genes. Sometimes it is also called Trisomy 21. This name might sound technical, but we will break it down together. It simply means that a person with Down syndrome has an extra or third copy of their 21st chromosome, which is a tiny package of genes inside our cells. This extra chromosome changes how a baby's body and brain develop during pregnancy and after birth. It can lead to certain physical characteristics and some level of intellectual and developmental delay. It is so important to remember that every person with Down syndrome is a unique individual. They have their own personalities, their own strengths, and their own dreams, just like everyone else. They are sons, daughters, brothers, and sisters. They bring immense joy and love to their families and communities, teaching us all valuable lessons about acceptance, resilience, and unconditional love. For example, think of a young boy named Leo who has Down syndrome. Leo might take a little longer to learn how to walk or talk, but with the help of his loving family and therapists, he learns to ride his bicycle and loves to sing his favorite songs. He goes to school with his friends and is known for giving the best hugs. Stories like Leo's show us that while Down syndrome presents challenges, it does not define a person's potential for a happy, fulfilling, and meaningful life. We will explore all aspects of this journey with warmth and hope. Many parents wonder why Down syndrome happens. It is very important to know that it is not caused by anything the parents did or did not do during pregnancy. It is usually a random event that occurs at the time of conception, when the egg and sperm first meet. Our bodies are made of tiny cells, and inside each cell are 46 chromosomes, arranged in 23 pairs. These chromosomes carry the genetic instructions for our growth and development. In most cases of Down syndrome, a mistake happens when the cells are dividing, resulting in an extra full or partial copy of chromosome 21. This event is a matter of chance. It can happen in any pregnancy, to parents of any age, race, or economic background. There is nothing you could have done to prevent it. While the risk of having a baby with Down syndrome does increase as a mother gets older, especially after the age of 35, the majority of babies with Down syndrome are born to mothers who are younger than 35. This is simply because younger women have more babies overall. Understanding this helps to remove any feelings of guilt or blame, which parents should never have to carry. So, what are some of the common signs we might see in a child with Down syndrome? Every child is different, but there are some physical characteristics that are often present. Many babies born with the condition have lower muscle tone, which can make them seem a bit, floppy when you hold them. They may have a single deep crease across the palm of their hand, sometimes called a simian crease. Slightly flattened facial profile, a small nose and eyes that may slant gently upward. They may also have smaller hands and feet. Beyond these physical signs, development might happen at a different pace. A child with Down syndrome might learn to sit up, crawl, walk, and talk a bit later than other children. Most individuals will have some degree of intellectual disability, usually in the mild to moderate range. This means they can learn and do many things, but it may take them more time and practice. Just like a girl named Maria, who, with extra help in school, learned to read and now loves working at her local library. These signs are just part of the picture, not the whole story of who a person is. How do doctors find out if a baby has Down syndrome? The process can begin during pregnancy with screening tests. These tests do not give a definite, yes or no answer. Instead, they estimate the chance or risk of a baby having the condition. They are very safe for both mother and baby. These screenings usually involve a blood test for the mother and a special ultrasound scan called a neutral translucency scan. The blood test measures certain proteins and hormones. The ultrasound looks at a small fluid-filled space at the back of the baby's neck. The results are combined with the mother's age to calculate a risk score. If a screening test comes back with a high-risk result, it can be a worrying time for parents. It is important to talk with your doctor or a genetic counselor. They will explain what the result means and discuss the next steps. A high-risk result does not mean the baby definitely has Down syndrome. It just means that more precise testing, called diagnostic testing, may be offered. These further tests are a personal choice for every family. The decision to proceed depends on what information the parents feel they need to prepare for their baby's arrival. Diagnostic tests are different because they can provide a conclusive answer. They do this by looking directly at the baby's chromosomes from a sample of cells. The two most common tests are chorionic villus sampling, usually done between 10 and 13 weeks, and amniocentesis, typically performed after 15 weeks. CVS takes a tiny sample of the placenta. Amniocentesis takes a small amount of the amniotic fluid surrounding the baby. Because these tests are invasive, they carry a very small risk of miscarriage, which your doctor will discuss with you in detail. Sometimes, a diagnosis is not made until after the baby is born. To confirm this, a blood sample is taken from the baby for a test called a karyotype analysis. This test creates a picture of the baby's chromosomes, allowing doctors to see the extra 21st chromosome clearly. Once a diagnosis is confirmed, the medical team will also do a thorough checkup to look for any associated health conditions like heart issues, which are common and often treatable with early intervention. This ensures the baby gets the best possible start in life. While there is no cure for the extra chromosome that causes Down syndrome, there is a wonderful world of support treatments and therapies available. These interventions can make a huge difference in a child's development and quality of life. The key is starting early. Early intervention programs are designed to help infants and toddlers from birth to age 3. These programs are tailored to each child's individual needs and can include several types of therapy. The goal is to help them reach their full potential, one step at a time, in a supportive and nurturing environment. Physical therapy is often one of the first supports a child receives. Because babies with Down syndrome often have low muscle tone, a physical therapist can help them build strength, improve their coordination, and reach motor milestones like rolling over, sitting up, and walking. Speech-language therapy is also vital. It helps not only with developing language and communication skills, but also with feeding challenges that can occur due to low muscle tone in the face. Then there is occupational therapy, which helps children learn the practical skills of daily life, dressing, eating with utensils, and writing. Regular medical care is also a cornerstone of supporting a child with Down syndrome. Children should have regular checkups with their pediatrician to monitor their growth and development. They will also need to see specialists to check for and manage common health issues. For example, about half of all children with the condition are born with a heart defect, many of which can be corrected with surgery. Regular hearing screenings and vision screenings are crucial, as are checks for thyroid function and other potential health concerns. A dedicated team of doctors helps ensure the child stays as healthy as possible. Beyond the medical team, the most important support comes from family, school, and the community. Today, many children with Down syndrome are included in regular classrooms alongside their peers, with extra support from special education teachers and aides. This inclusion benefits everyone, teaching all children about diversity and acceptance. Community programs, sports teams like the Special Olympics, and social groups provide wonderful opportunities for friendship, activity, and a sense of belonging. This network of care helps individuals with Down syndrome to thrive and lead active, engaged lives. Is there a way to prevent Down syndrome? Since it is most often a random genetic event, there is no sure way to prevent it from happening. The only known factor that increases the statistical risk is the mother's age. For women thinking about pregnancy, especially those over 35, speaking with a genetic counselor can be very helpful. A counselor can provide personalized information about genetic screening and diagnostic tests, helping parents make informed choices that feel right for them. No matter a mother's age, taking care of herself during pregnancy is always the best advice for a healthy baby. This means focusing on good prenatal care, eating a balanced diet, taking a prenatal vitamin with folic acid, getting regular gentle exercise, and avoiding alcohol, smoking, and illicit drugs. Thank you for joining us at UMCC Medical Consultants Connectors today. Your health and your journey matter to us. Please subscribe, like, and share this guide.